Pancreatic cancer is a very difficult disease to treat, and one of the major challenges is we don't have effective therapies outside of chemotherapy, maybe surgery and radiation therapy, to treat this disease. And there's a real need for cancer-specific solutions for treatment options for our patients.
There are many challenges treating pancreas cancer patients. Number one is the disease itself. This is a disease that is highly refractory or resistant to any kind of treatments, including surgery, radiation, or chemotherapy. The second level challenge is with patients and the family. It's a huge burden to deal with. Pain, weight loss, fatigue, poor appetite, and the prognosis is not great.
The mission of our pancreas cancer group is to develop and design new immunotherapies and targeted immunotherapy combinations for pancreas cancer patients. Our hope is both to develop these novel therapies thinking about the specific biology of pancreas cancer and employ them in patients and match the right therapy to the right patient who might likely benefit the most. 10 years ago when I started my faculty position here at Siteman Cancer Center, the survival rate of pancreas cancer was around 5%. Now it's 11%. That means we've made a lot of progress. Some of the challenges are still that we need to give the right treatments to the right patients. We need to develop a new lines of therapy that consider the specific biology of pancreas cancer and pancreas cancer patients and generate those new therapies.
I hope to see progress in two different directions. One will be how we treat pancreas cancer. We're still heavily relying on chemotherapy to treat patients. I hope to be able to lower the use of chemotherapy and incorporate a lot of targeted therapies in the body's immune system and prolong treatment response without incurring too many side effects. The second progress is our perception for pancreas cancer. It's been associated with quote-unquote death sentence for a lot of patients and families. But what I would like to encourage everybody to think about is that we have good people working on it. The progress I would like to see is patients and families not to be afraid. We will introduce new clinical trials that will not be less standard chemotherapy.
36 miles, ride safe, enjoy the ride.
Pedal the Cause is a great event where you are directly impacting our ability to do research on early phase studies. In these contexts, we can bring some of our best and our brightest ideas directly into patients, have early stage clinical trials, and then get enough of the data necessary to fund this at the national level.
This is a disease that cannot be cracked by one person or one team. You need a community to really go after the disease and improve the outcome. So joining Pedal the Cause makes me feel like I'm part of the team, and we're able to send direct message to patients and people around the community that we are all in this together.